Hey everyone, and welcome to another deep dive. Today we're tackling something, we all kind of think about, but maybe don't always want to talk about.
That's right, aging.
Aging, exactly, but we're going beyond, the typical stuff you hear, like, oh, you'll get wrinkles, and focusing on some really specific and honestly kind of surprising changes that happen in the body as we get older.
We've got a ton of research here that breaks down these changes system by system.
It's true. We'll also look at what all of this means for healthcare, and how we as future nurses and current nurses can best support our older adult patients.
And spoiler alert, it's about a lot more than just, preventing falls and managing medications.
Exactly. So to kick things off, I think everyone knows that globally we've got this huge increase in the older adult population.
It's massive. By 2050, over 2 billion people worldwide will be over the age of 60.
2 billion. Wow. That's like a whole other planet of people over 60. So clearly this is something all of us in healthcare, especially nurses, need to be prepared for.
Couldn't agree more. And to be prepared, we've got to understand what's actually happening in the body as we age. It's not just about getting older. It's about how our bodies handle stress and how we adapt to new challenges.
Right. So it's like how well we bounce back from things.
Right.
Yeah.
Exactly. That capacity, those reserves kind of shift as we age.
Okay, that makes sense. So where do we start seeing those shifts? Like what are some of the first signs that things are changing?
Well, even something as simple as checking someone's vital signs can give you clues.
Really? Even just like heart rate and blood pressure?
Yep. Even those, you might think that as we get older, resting heart rate goes up.
Yeah, I guess I would assume that.
It actually stays pretty steady. What changes is the maximum heart rate.
Oh, interesting. So the highest your heart rate can get when you're really exerting yourself.
Exactly. That drops significantly as we age.
I never thought about that. So even if someone's been active their whole life, their heart might not be able to handle the same level of intensity as they get older.
Right, and that can have implications for exercise, for managing stress, even for just understanding how someone responds to different situations.
That's a great point. Okay, what about blood pressure? Does that change predictably?
Blood pressure is definitely one to watch as we age, especially that top number, the systolic blood pressure. It tends to creep up.
Why is that?
Part of it is because the aorta, that main artery leaving the heart, gets stiffer and less flexible over time.
Oh, so it's like a pipe that's kind of getting a little bit, hardened and maybe even a little bit twisted.
That's a good analogy. That impacts blood flow, and that contributes to higher blood pressure.
So it's not just about lifestyle choices or diet. It's an actual structural change in the arteries themselves.
Exactly. It's something we need to be aware of and that we can educate our patients about.
Absolutely. Then there's that thing where you stand up too fast and get lightheaded. What's that called again?
Orthostatic hypotension.
Right, orthostatic hypotension. That seems to happen more as people get older, too.
It does. And for us as nurses, it's a big red flag for fall risk.
Okay, so we've talked a bit about what's happening inside the body. What about those more visible signs of aging?
Oh, there's a lot more to those than meets the eye, too. For example, let's take the skin.
Sure, everything's about wrinkles.
Wrinkles are definitely part of it, but the skin also thins, and it becomes less vascular as we age.
Okay, so what does that actually look like?
Well, it means the skin is more fragile and more prone to injury. We might see those really vivid purple patches called actinic purpura.
Oh yeah, I've seen those before, but I never knew what they were called.
They're common in older adults, especially on the forearms and hands.
It's interesting how even something that seems kind of superficial can actually tell us a lot about what's happening below the surface.
Exactly, and the same goes for nails and hair. Nails tend to lose their luster, they become more brittle hair thins. There are even some interesting gender differences in how hair patterns change as we age.
Like what?
Well, men might notice more hair loss on their scalp, but hair growth in their ears and nose, while women often see more thinning all over.
Huh, interesting. So it's like these little outward clues can give us a bigger picture of someone's overall health?
Exactly. It's all part of the assessment.
Okay, so we've covered skin, hair, nails. What about our senses? Do those tend to decline in a predictable way as we age?
Each sense has its own sort of trajectory. Let's start with vision.
Okay, vision seems like a big one.
It is. As we age, we lose fat around the eyes, which can make them appear sunken.
So it's not just about needing reading glasses. There are other changes happening too.
Definitely, dry eyes are also incredibly common, and the pupils actually get smaller, which can make eye exams a bit more tricky.
Makes sense. So what else happens with vision?
Well, almost everyone develops presbyopia as they get older. It's that difficulty with near vision.
Yeah, I'm starting to notice that myself.
And here's a weird fact. The lens of your eye actually keeps growing throughout your entire life.
Wait, really? It keeps growing?
Yeah, which can actually increase the risk of glaucoma.
So it's not always about things shrinking and wearing down as we age. Some things actually keep growing.
Exactly. It's all part of the amazing complexity of the human body.
Okay, so that's vision. What about hearing?
Hearing loss is another one that's almost universal as we age. We call it presbycusis.
Presbycusis, got it. So how does that usually develop?
It's usually pretty gradual, and it starts with those high-pitched tones that are outside of normal speech range.
Oh, so you might not even notice it at first.
Exactly. It's the subtle high-frequency sounds that go first.
As nurses, we really need to pay attention to that and make sure we're communicating clearly with our older patients, especially in a busy hospital where there's already a lot of noise.
Absolutely. Even just turning down the TV or speaking a little slower can make a huge difference.
Okay. What about changes in the mouth?
The mouth is another area where age-related changes can have a big impact. As we get older, saliva production decreases.
So dry mouth.
Yep. Dry mouth, which can make it hard to swallow pills.
Oh, right. That makes sense. And what about taste?
Taste buds change too. Bitterness and saltiness tend to intensify as we get older.
So food might not taste as good as it used to.
Exactly. It's something to keep in mind when we're talking about nutrition for older adults.
Absolutely. Okay, let's move on to the chest and lungs. Does breathing just become more difficult as we age?
It's more nuanced than that. It's not just about difficulty breathing. It's about how the respiratory system's ability to handle challenges changes.
Okay, what do you mean?
Well, lung capacity during exercise declines. The muscles we use to breathe weaken. Even coughing becomes less effective.
So even a simple cold could be more serious for an older person.
Right, and it makes things like pneumonia a much bigger risk.
Wow, so it's really important to encourage older adults to get their pneumonia vaccine.
Absolutely. Prevention is key, and early detection of any respiratory issues is crucial.
Okay, makes sense. Let's move down to the heart now. We already talked about the aorta becoming stiffer, but what other changes happen in the cardiovascular system as we age?
Well, interestingly enough, cardiac output, that's the amount of blood the heart pumps per minute, generally stays pretty stable.
So the heart is still working just as hard.
In a way, yes, but the way it achieves that output changes. The heart starts to rely more on the atria, those upper chambers, to contract and push blood into the ventricles.
So the atria are working overtime.
You could say that, and that's why atrial fibrillation, that irregular heartbeat, becomes more of a concern as we age.
Makes sense. And what about those heart murmurs? I've heard those are more common in older adults too.
They are aortic sclerosis, which is basically a stiffening of the aortic valve, is a really common cause of murmurs in older adults. It's usually harmless, but something we want to monitor.
Okay, so not all murmurs are a cause for concern, but we should still be listening for them.
Exactly. And then there's mitral regurgitation, where the mitral valve doesn't close tightly. That's another one we hear often in older adults.
It sounds like knowing the difference between normal age-related changes and things that need intervention is really important.
It is. It's all about having that deep understanding of how the aging process works.
Okay, let's talk about breasts now. Are there significant changes there as we age?
For women, breasts tend to become smaller and more pendulous over time.
Okay, and the milk ducts?
The milk ducts become more prominent, which can actually make it harder to detect lumps during breast exams.
Oh, wow. So that's something to be extra aware of.
Definitely. And for men, they might experience some breast changes too.
Like what?
Gynecomastia, which is breast enlargement, it's not uncommon due to hormonal shifts and weight gain as men get older.
Interesting. It's amazing how these changes happen throughout the entire body in places we might not even think about.
It really is. Okay, what about the abdomen? I know a lot of people talk about getting a softer belly as they age.
Is that just about gaining weight?
It's partly due to weakening abdominal muscles and fat redistribution.
Okay. But is there anything else going on there that we need to be aware of?
Here's a crucial point. The symptoms of acute abdominal issues can be a lot less dramatic in older adults.
Really? Like, what do you mean?
Pain might be less severe, fever might not be as high.
So something like appendicitis might not present the same way in an older person.
Exactly. That's why we need to have a really high index of suspicion when we're assessing older adults. We can't just dismiss those subtle symptoms.
That's really important to remember. It's like we have to be even more attuned to those subtle cues because they could be masking something serious.
You got it. Early intervention is key. Okay, let's talk about the genitourinary system now.
Sure. I know menopause is a big one for women, but what about men? Does sexual interest decline as they age?
Interestingly enough, studies have shown that men's sexual interest seems to remain pretty consistent throughout their lives.
Really?
Yeah. However, erections do change, and erectile dysfunction becomes more common.
Why is that?
It's often linked to vascular health and medications, not necessarily a psychological issue.
So it's important to look at the whole picture.
Exactly. And for women, menopause, of course, brings on a lot of changes.
Like what?
Hot flashes, vaginal dryness, urinary changes. And for both men and women, urinary incontinence becomes more common.
Right. And incontinence is not just an inconvenience. It can really impact someone's quality of life.
Absolutely. It's something we need to address with sensitivity and compassion.
Okay, we're almost to the end of our system-by-system tour here. What about the musculoskeletal system? I know bone loss is a big concern.
Bone loss is definitely a major concern, but sarcopenia, which is the loss of muscle mass, is often overlooked.
Oh, that's interesting. So it's not just about bones getting weaker, it's not losing muscle too.
Exactly. And what's fascinating is that exercise can actually help counteract both bone loss and sarcopenia.
So it's never too late to start being active.
Never too. And what about height loss?
Yeah, I know people tend to get shorter as they age. Is that all about shrinking bones?
It's not just the bones. A lot of height loss comes from changes in the spine, like thinning of the discs and kyphosis, which is that rounding of the upper back.
Okay, so it's a combination of factors and something to keep in mind when we're assessing a patient's posture and mobility.
Exactly. It all ties together. Finally, let's talk about the nervous system, the command center of it all. How does aging affect the brain and nerves?
I think a lot of people worry about, becoming forgetful or losing their memory as they age.
Right. It's a common concern. And while brain volume does decrease with age, most older adults adapt remarkably well.
So what's normal and what's not?
Well, what we call senior moments, like forgetting names or misplacing things, are very common and usually nothing to worry about.
So just because someone forgets where they put their keys, it doesn't mean they have dementia.
Exactly. It's important to distinguish that kind of benign, senescent forgetfulness from dementia, which is a more serious condition involving progressive cognitive decline.
Okay, that's good to know. What about delirium? Isn't that a concern for older adults, especially in hospital settings?
Delirium is definitely a red flag. It's that sudden state of confusion that often signals another underlying issue like an infection or a medication reaction.
So it's a symptom of something else.
Exactly. It's our job to figure out what's causing the delirium and treat it quickly.
Okay, that makes sense. What about changes in motor function?
You might see things like slower movements, reduced muscle bulk, and even benign tremors, which can sometimes look like Parkinson's disease.
So we need to be aware of those changes, but also know when to refer to a specialist for further evaluation.
Exactly. It's all about careful assessment and having that deep understanding of the nuances of aging.
It sounds like geriatric nursing requires a whole other level of detective work.
It does, but it's also incredibly rewarding to be able to help older adults maintain their independence and quality of life.
Absolutely. And with the older adult population growing so rapidly, we need more nurses who are passionate about this kind of care.
I couldn't agree more.
It is rewarding, and it's definitely a growing field for nurses because, like we've been talking about, the healthcare needs of older adults are so unique.
They are. So let's shift gears a bit and talk about some of the challenges older adults face when it comes to getting the care they need.
Okay, what are some of those challenges?
Communication is a big one. We've talked about all those changes that happen with aging, hearing loss, vision impairment, slower processing speed.
Right, it can make it harder for older adults to communicate effectively with their healthcare providers.
Exactly. And on the flip side, we as providers need to be extra sensitive to those communication barriers and adjust our approach.
It's not always easy in a busy hospital setting, but it's so important to take that extra time.
It is. And there are some tools that can help, like the 10-minute geriatric screener.
Oh yeah, I've heard of that.
It's a quick assessment that can help identify potential issues that might affect communication or overall well-being.
So it's like a quick way to flag areas that need further assessment.
Exactly. Okay, so communication is key. What else makes healthcare for older adults different?
Well, we touched on this earlier, but I think it's worth emphasizing again. Those classic signs and symptoms of illness that we learn about in textbooks might not always be as clear-cut in older adults.
That's right. Things can present differently.
Like what?
Well, fever, for example, might be less pronounced in an older adult who has a serious infection.
Really?
Yeah. And chest pain might not be the hallmark symptom of a heart attack in an older person.
Wow. That's kind of scary, to be honest.
It is. It requires us to really shift our thinking when we're caring for older adults. We can't rely on those textbook presentations.
And it's another reason why understanding those age-related changes is so important. Okay, so acute illnesses might present differently. What else?
Well, there's also something called geriatric syndromes. These are basically clusters of symptoms that signal underlying vulnerability in an older person.
Geriatric syndromes. Can you give us an example of what that might look like?
Sure. Let's say an older patient comes in after a fall.
Okay.
We need to look beyond the immediate injury and think about what might have contributed to the fall in the first place.
Right, like was it a balance issue?
Possibly. Or maybe dizziness from orthostatic hypertension weakness from sarcopenia vision problems, medication side effects.
So it's like a web of interconnected factors, and we need to unravel that web to really understand what's going on.
Exactly. It's not just about treating the fall. It's about addressing those underlying vulnerabilities that led to the fall in the first place.
Okay, that makes sense. And this kind of holistic approach is important when we're talking about functional impairment too, right?
Absolutely. Functional decline can have a huge impact on an older adult's independence and quality of life.
Right, because if they can't do the things they used to do, it can really affect their well-being.
Exactly. So assessing their ability to perform activities of daily living, or ADLs, is crucial.
ADLs, those are things like bathing, dressing, eating, using the toilet.
Right, those basic self-care tasks. And we also need to consider instrumental activities of daily living, or IADLs.
Which are?
More complex tasks, like managing finances, using transportation, preparing meals.
So assessing ADLs and IADLs helps us gauge how much support a patient might need to stay safe and independent in their own home.
Precisely. And then there's medication management, which is a huge area of concern for older adults.
Right, because they're often on multiple medications for different conditions.
Exactly, and that's what we call polypharmacy.
Polypharmacy is a mouthful.
It is, and it's a big problem because older adults are more vulnerable to adverse drug effects. Their bodies metabolize medications differently.
So we need to be really careful about prescribing and monitoring medications in the older adults.
Absolutely. And there's a great resource called the Beers Criteria that lists potentially inappropriate medications for older adults.
Okay, Beers criteria, I'll have to look that up. What about lifestyle factors? Do those still matter as we age?
They matter a lot. Smoking cessation is still crucial even for older adults.
Even if they've been smoking their whole lives?
Even then. And alcohol limits are actually lower for older adults because of those changes in metabolism we talked about.
Interesting. It's like we need to be extra cautious about everything.
In a way, yes. But it's also about empowering older adults to make healthy choices, and nutrition is a big part of that. Nutritional deficiencies are surprisingly common in older adults.
So making sure they're getting enough of the right nutrients is key.
Exactly. Okay, there's one more thing we need to talk about: advance directives.
Ooh, that's a tough one.
It is, but it's so important to have those conversations with older adults about their end-of-life wishes.
And encourage them to appoint a healthcare proxy.
Exactly. It's about respecting their autonomy and making sure their preferences are honored.
It's a difficult conversation, but a necessary one. So it sounds like healthcare for older adults is really about so much more than just treating diseases.
It is. It's about taking a whole-person approach, considering all those interconnected factors that contribute to their well-being.
Okay, so we've talked about the physical changes of aging, the challenges in healthcare. What about the good stuff? What can we do to promote healthy aging?
That's what we'll dive into next. There's a lot we can do to help older adults age well and maintain their independence and vitality.
I like that. Let's talk about that. What are some evidence-based strategies for promoting healthy aging?
Well, let's start with screening recommendations. For older adults, the decisions about screening are a little more nuanced.
How so?
We have to carefully weigh the benefits of screening against the potential harms.
Right? Because sometimes more testing isn't always better.
Exactly. And shared decision-making with the patient and their doctor is crucial.
So it's not just about following those general age-based guidelines. It's about individualizing the recommendations.
Precisely. What about vision and hearing?
Yeah, those seem like important ones.
They are. Regular vision and hearing checks are crucial for older adults.
To catch problems early.
Exactly. And as nurses, we need to be aware of those sensory changes and make sure we're communicating in a way that our patients can understand.
Okay, vision and hearing are top priorities. What about exercise?
Exercise is huge. It has so many benefits for older adults.
Like what?
It reduces mortality, improves function boosts, mood, protects cognitive function.
Wow, those are some serious benefits. What type of exercise is best?
A combination of aerobic activity and strength training is ideal.
So getting those muscles moving is key. What about fall prevention?
Fall prevention is another big one. And the good news is that simple modifications can make a huge difference.
Like what?
Improving lighting, installing grab bars, removing tripping hazards.
So it's about creating a safer environment.
Exactly. And as nurses, we can help assess the patient's home environment and make recommendations to reduce fall risks.
Okay, fall prevention check. What about immunizations?
Immunizations are essential for older adults.
Because their immune systems are weaker.
Right, so staying up to date on vaccines like flu, pneumonia, and shingles is crucial.
Okay, vaccinations got it. What else do we be thinking about?
Let's not forget about the 3Ds: delirium, dementia, and depression.
Right, we talked about delirium earlier, but it's important to be able to distinguish between these three conditions.
It is. They can present similarly, but they require very different approaches to care.
So delirium is that sudden confusion. Dementia is a more gradual cognitive decline.
And depression, although common, is often underdiagnosed in older adults.
So we need to be aware of the signs and symptoms of all three and be prepared to intervene appropriately.
Exactly. Okay, and finally, let's talk about elder mistreatment.
Oh, that's a tough topic.
It is, but it's something we need to be aware of. Older abuse and neglect are more common than we'd like to think.
And it's often underreported.
Right, because older adults might be hesitant to speak up, so it's up to us to be vigilant and look for those red flags.
Like what?
Signs of physical abuse, emotional abuse, financial abuse, any suspicion of mistreatment needs to be reported.
Absolutely. Protecting older adults is everyone's responsibility. Wow. This deep dive has been really eye-opening. I feel like we've covered so much ground.
We have. It's a lot to take in.
It is, but it's so important. We've talked about the physical changes that happen as we age, how those changes can impact healthcare.
And most importantly, what we can do to promote healthy aging.
Right, because it's not all doom and gloom. There's so much we can do to support older adults and help them thrive.
Exactly. Aging is a natural part of life, and it can be a time of continued growth and fulfillment.
I love that perspective. So to wrap things up, what's one key takeaway you want our listeners to remember from this deep dive?
I think the biggest thing is to remember that aging is not a one-size-fits-all process. Everyone ages differently.
Right, so we can't just make assumptions based on someone's age. We need to treat each person as an individual.
Absolutely. And we need to be advocates for our older adult patients. Make sure they're getting the care they need and that their voices are being heard.
That's so important. And to our listeners out there, whether you're a nursing student, a seasoned nurse, or just someone who's interested in learning more about aging, we hope this deep dive has given you some new insights.
We encourage you to keep learning, keep asking questions, keep exploring this fascinating topic.
Because the more we understand about aging, the better equipped we'll be to care for ourselves and our loved ones. Thanks for joining us.